When we're talking about prolapse, what does that mean?
Prolapse means we're talking about pelvic relaxation and drop or collapse of the structures in the pelvis into the space of the vagina and sometimes all the way out the opening to the outside.
So what are some of the organs that can do that?
So bladder falling down into that space we call a cystocele.
Cystocele.
Back wall of the vagina and rectum pushing forward we call a rectocele. And if the uterus is dropping down we call that uterine prolapse. But many times if the patient's already had a previous hysterectomy and they feel an egg or a bulge in the vagina that gets worse as the day wears on and it feels like something's just going to fall out, then the top of the vagina, we call it the vaginal vault, can drop down and have vaginal vault prolapse, and very often bowel kind of fills that space and makes it a big round egg, and we call that an enterocele.
So I think the information from that is there are several different causes, so it's not easy just to do one without fixing or knowing that the other may fill that space?
Well, the key is we've got all of these important structures: urethra, bladder, vaginal walls, rectum, possibly uterus, and the female pelvic floor. And these structures are not only anatomically related, but they're functionally related. So the key is for the doctor and the patient together to figure out what are the structures involved with the prolapse, and then once you really understand what all is involved, then a plan to try to treat that for the patient can be put in place.
Can you fix that?
In most cases we can fix that. In many cases we can do some things non-surgically. We can fit the patient with a pessary sometimes, and in many cases we have to go to more advanced therapy like surgical reconstruction.